And welcome back, everybody. Yes, Friday is Valentine's Day. Are you prepared? Yeah, do you have the chocolates and all the sweets? Are you a diabetic, though? That can be an issue. Or are you married, or your significant other, your lovey, is a diabetic? This could be an issue, too. Joining me now is Dr. Challapalli from St. Mary's to talk to us a little bit about diabetics and blood sugar and making sure that you stay in check for Valentine's Day. Dr. Challapalli, thanks for being with us. We really appreciate it. Let's go ahead and start off first. Valentine's Day coming up, of course. That means a lot of chocolate and sweets in the area, in the house, as gifts, etc. Talk to us a little bit about, is it okay for those with diabetes to indulge a little bit on this special day?
Well, I think every diabetic patient is a little bit different, but in general, a little bit of sugar is probably not a bad thing. And if you want to have that sugar feel, you could try some fresh fruits that might provide that sugary sensation. I mean, sugar itself doesn't cause diabetes, but it's the calorie intake and the carbohydrate intake that comes with that can be a problem.
Right, it's the whole picture. It's not just one thing. So how should those with diabetes monitor their blood sugar levels if they do decide to indulge? We're talking about a spike here, right?
Right, and some diabetic patients are already monitoring it on a routine level with their finger sticks, and some diabetics are pre-diabetics, so they're not necessarily monitoring it on a regular basis. But I really think the key is to just eat healthy, exercise, and watch what they're eating during this time period.
And Dr. Challapalli, you see it all the time. You go to the grocery store, you're craving something sweet, you go down that sugar aisle, the candy, right? And then the very end is that small section of that sugar-free candy, and you start going, oh yeah, here I go. Is that really the good option for diabetics?
Well, you know, sugar-free is not necessarily fat-free, and though they may be a little lower in calories, and again, it's maybe, and maybe a little lower in carbohydrate intake, they can be high, especially the chocolates, in saturated fat because the cocoa butter has the saturated fat. So it's a little bit of a myth that sugar-free is always safe. You have to be kind of careful on how much you eat when you try these sugar-free candies.
And real quickly, just to sink this one in here, if someone did indulge a bit too much, maybe they're not fully aware of their diabetic situations, there's something they should look out for and think, maybe I need to go to the doctor about this. I'm feeling funny.
Well, I think it's always good for everyone to see their doctor regularly and be screened for diabetes, high blood pressure, heart disease. And the key is to eat healthy, exercise, and take care of yourself and everything in moderation. And February is Heart Month, so it's a great time for a cardiovascular screening as well, and St. Mary's offers that.
Awesome. Dr. Challapalli, thanks so much for being with us. A lot of great tips. All right,
Thank you.
Thank you. We're going now to Tim Studebaker with a quick look at our forecast. It could be getting wild later with some wind. Hi, Tim.
That's right. Good morning to you. Yeah, we do have a wind advisory in place as well as a lake wind advisory for Pyramid Lake and Lake Tahoe. We'll talk more about the forecast after the break.